Not bad, right?
Oh, yeah. That felt good.
Again. So I got Michael here today, and you have a few big issues that you're trying to work on, right? So you had weakness in the legs, and tell us how that started.
Well, originally it started with my neck. I was unable to lift my arm past the horizontal position. And I went to the doctor, and they said it's a problem with my neck, cervical spine. So I ended up having a decompression infusion in my neck.
Okay.
Which got rid of the problem.
Which is a surgical procedure.
Right.
Right. Which did. Now here, lift your arm
now.
now.
Now I can lift my arm.
Good.
But subsequent to that, I started to have problems with my mobility, my legs, specifically my calf muscles. I was weakness in the legs, having trouble with my gait. So I went to the hospital for special surgery, and they did a bunch of MRI studies and nerve conduction studies, and determined that I had compression of the nerves in the lower spine, so L4, L5, S1. So they recommended decompression surgery for that, which I had in 2018.
And that was somewhat successful.
Well, it got rid of any sciatic pain that I was experiencing, but it didn't resolve the problem with the weakness in the leg muscles.
Okay. And your walking gait is definitely affected.
It's been much worse. I'm very slow. I have trouble doing stairs.
Like I noticed when you walked in that you were like moving slow and limping a little bit.
Yes.
But are you limping out of pain or limping out of weakness and balance?
It's more weakness and balance.
Okay.
It doesn't hurt to walk.
Okay. But I just want you to know, watching this, he's not going to feel like a totally different human in a few minutes of work. But we should see today if you feel like we're onto something. How's that sound?
I'm not expecting a miracle.
Okay.
So that's good.
So right away, we found a spot right here. And this muscle is called the QL. But that's the kind of the American saying for a QL. Quadratus lumborum, which is Latin. It's named after the shape and location. So it's a quadrangle muscle at the lumbars. And we have one on the left and one on the right. And if you think about it, the rib cage the thoracic area has a rib cage. So there's more stability, but also less motion. The neck is an exposed area of the spine. There's no rib cage around it to stabilize it. So we get a lot of motion in our neck, but less stability and more chance of injury and more chance of wear and tear. But again, between the rib cage and the pelvis, you have an unexposed stability. So you get more motion. You can bend down and tie your shoes. You can twist. But these muscles take a lot of wear and tear, and they get a lot of tenderness and abuse, especially if you're dealing with an issue. So right away, when I came in on this left QL, he immediately goes, whoa, I feel that one. Kind of like that, right?
Yep.
You felt it. I'm at the top of the muscle here, which is more of like the upper lumbars, and now I'm tracing it down towards L5, and then finally the sacrum.
I had a couple of MRI studies which showed that the inside of the spine was growing extra bone and impinging on the nerves.
Oh, wow. So he had extra bone growth within his probably canal, creating a stenosis, but also irritating the nerve tissue, right?
Correct. So as a result of that, I ended up having decompression surgery.
Did they scrape out the little barnacles?
Yeah, that was what they were supposed to do, yeah.
Yeah. And now I'm in his glute on the right side. Can you feel some of these spots, Michael?
They're not painful.
Okay. Does it kind of feel good in a therapeutic way?
Yeah, it does. It feels like a deep tissue massage.
Yeah. So now I'm going to bring his leg up and just work a little bit more into his hamstring.
If you twist to the side, the hip joints will be painful.
Like if I come this way?
Yeah.
It's kind of confusing, but when I bring the leg in, that's actually external rotation. When I bring the leg out, that's internal rotation. So that's internal, which is horrible, and decent. You have decent external. Do you feel that?
Yeah.
It's nice. But your internal is really locked up on both sides. That is probably been there for a while.
Yeah.
Big breath in and blow it out. There's one.
Yeah. That
Breath
felt
in
good.
Again. You said that felt good at pop finally. So let's have you lie on your back next, okay?
Yep.
I'm going to release this one
So is the fact that I got plates in my neck going to affect any of this?
Yes, it's going to affect the way I adjust it. So I'm going to do very light impulse into C2 here. You didn't have any done at C2 though, correct?
No.
It's lower cervicals.
Yeah.
So I'm just going to be above that, and I'm not going to do much. It's either going to release or it won't. It's not bad, right?
Ooh.
So that was C2.
Mm-hmm.
So I'm stretching him right now.
That actually feels good.
Do you still work full time?
Yeah. It's mostly sitting at a desk.
Let's have you lie on your side facing me. And let's get you off this shoulder a little. So I'm going to pull the shoulder through. Yeah, that's a good angle. And then this comes up here like this. Big breath in and blow it out. Let's go to the other side. There it goes, a little one.
Yeah.
So that should feel nice when even just little ones release. So I've been adjusting people for 26 years, and I feel like I have a kind of sense of like what the body wants to give me, and also when the body's going, no mas, I don't want any more. So when I was there, I was just kind of bouncing a little bit and kind of playing into it, and it went, but I wasn't going to go, because you've had surgery.
Everything's tight. Too.
Yeah, we don't want to do that. So now I'd like you to line your belly again. I'm going to use it. There we go. The pelvis was tilted a little bit. Good. Now come stand and walk around. Say, hey, cool. And then turn around and come back.
Actually, I don't feel like I'm limping now. Yeah, that's much better.
Okay, good. So he said he's not limping. You feel a little better.
Right.
So what was different? You said your gait was smoother?
Whatever muscle you were working on there,
Yeah.
I think that's the reason I was trying to compensate. And,
Okay. That one we first found.
yeah,
right?
it's not doing that anymore.
Okay.
So.
I have a way for you to work on that at home then.
Okay.
Okay. I like these type of oversized balls.
Yeah.
You can find them on Amazon. I can show you a link. This is 5 inches in diameter.
Yeah.
But you could also use this, which is about the same size. I like these. They're easy. They make expensive ones. This one's about $19. But you lay on your back right on that spot and do nothing. Just let the ball work. And we can try right now.
So that's like pressure point.
Yeah, it's called like sustained pressure. So it's not a foam roller where you're, working it. You just find the spot and just breathe on it. It does a lot.
Yeah.
Like you'll feel it. And if you do it every day, even a couple of times a day consistently, you'll start to really let go of that muscle. So it's not gripping. And then once it stops gripping, it won't throw off your pelvic alignment.
Yeah.
Because I feel like it's doing this to your pelvis.
That's what I feel like when I'm walking too.
So that's why it was the first place I touched, and I got it to soften. Now you're walking with a level pelvis,
Yeah.
and you don't feel like you're going to fall over. So it's slightly left of center, the lower back, that same spot that I put in there. It's going to lift you in the air. That's good.
Oh.
And then this leg goes straight, and this one acts as a rudder. Once you find a good spot, you can tilt this towards me and get it on an angle also.
Well, right here is exactly where you're pushing.
Once you find it, don't jiggle around so much. Just be there.
Okay.
But you can imagine if you start to soften this up and get it to be more taffy-like, more elastic, because it feels like beef jerky or rawhide.
Yeah.
And we need it to be more soft and supple. The muscle, when it's supple, will let go of the pelvis, and you won't be walking tilted. You're walking like the Leaning Tower of Pisa.
That's what it feels.
Now watch, if you don't do anything except the knee, bring the knee this way, and you'll feel how that dials it in a little, doesn't it? And sometimes I lift this arm to clear my rib cage up. And so you can play with the angle, and you could also move it up a centimeter and move it down a centimeter.
Like eventually the pain kind of subsides.
Yeah. When I do this, at first I'm like,
Yeah,
like it hurts a little bit.
it does.
But I'm able to get kinks out sometimes without even getting a chiropractic adjustment. So if I don't have anybody to give me an adjustment, I just do this, and it really helps me.
Yeah.
All right, so we just did some good stuff with Michael. It's a good start. Like I said in the beginning of the video, like today was just kind of a chance to see if we could maybe make progress. And it would take him a little time because he's had this for a few years, right? And even probably before your surgery, it was probably getting bad for a while that provoked surgery.
Yes.
So it might be 4, 5, 6 years since you felt great.
It has been. Yes.
And so, you know, he'll decide whether he wants to do more work here. I always try to do a good job and then give people a chance to decide if they ever want to come back. How did it go today, though?
Good.
Okay. Thanks for coming today. I appreciate it.